Hello, everyone. It is Emily from Dallas Moms, and we are having a very interesting interview discussion today with my new friend, Dr. Molly O'Shea. She is with a new partner of ours called Nurture Genomics, and I have been really interested, kind of like reading their information. They sent me a few videos to watch. And then I was like, wow, I have questions and I want to ask. And so we're having this kind of live video discussion today to allow me to answer ask my questions and get some answers kind of right on the spot. So I'm going to get us started. I'm going to give a bit of a bio about Dr. O'Shea, and then hopefully she's going to tell us maybe a little bit more about herself. So Dr. O'Shea is Nurture's pediatric medical director and a mom to 4 children. Dr. Molly has over 15 years of experience as a pediatrician and owner of a family-centered practice. She is passionate about providing comprehensive and personalized care for children with rare and treatable genetic conditions, as well as empowering parents, that's me, with education and support. So thank you so much for joining us, and I would love to hear just a little bit more about yourself.
Yeah, well, Emily, I'm really excited to be here because as a pediatrician and a mom, I know how challenging it is to be a parent. And one of the things that my kids are grown up now, so I have had the entire parenting experience from those initial days of insecurity about, am I even doing this right? I remember bringing my first child home from the hospital and I totally even forgot to change her diaper for almost an entire day. I mean, it was just, and here I am a doctor, So we all experience those insecurities as a parent, and then you move through all those stages with your kids, and they get to adulthood, and you're excited to have them move out and become independent. And our goal as a parent, and mine was at least, and what I do as a pediatrician, is hope to help parents get to a point where not only the kids have confidence and independence, but the parents feel like they're doing the job that they need to do in order to raise healthy, independent, confident kids. And I'm partnering now and working with Nurture on the healthy side of things to help parents have that confidence and that security that they know what they need to know when it comes to their child's health.
Okay, fantastic. So I do have a list of questions. We're going to work through them. And my first question really is about Nurture. Like, who can use this service? Like, what age and stage is it for? Who's it applicable to?
Well, first I want to explain what Nurture is. You know what I mean? Because what is Nurture? So Nurture is a way for parents to understand if their children have a genetic risk for conditions that they can take action on early in their child's lives to prevent or improve outcomes. And these are conditions like, things that present in childhood. So we're not talking about like grown-up diseases here. We're talking about conditions that show up in childhood that you would want to know about as early as possible so that you could take action. And so Nurture is a way to take your child's genetic information and find those hidden issues and then be able to take actionable steps. So that's what Nurture does. So Nurture really is for everybody. I mean, who wouldn't want access to that information? It's for every healthy child, 3 and under.
Okay, excellent. So this is really when I have the benefit of having read some information about this, and we're kind of hearing your explanation now, but I will say, like, the whole world, and it is definitely an emerging and growing industry of like genetic testing. Like, we hear things about like 23andMe, and you can have prenatal screenings for this type of thing as well. And also, even as a woman, when I'm at my OB-GYN, we have a lot of family cancer in my family, so there's been testing that's been done for that. Can you tell us what is the difference between all that, and where does nurture kind of fit in this landscape?
Yeah, it is confusing, Emily, because you're right. I think all of us as people in the world are getting more and more familiar with genetic testing and genetic understanding of ourselves and others. And so it can get a little murky. Like, what is this, right? So 23andMe is looking for really very narrow, specific things. It's kind of like if you had a whole library of books, it's just looking for one or two or three books in that whole library, right? And what prenatal testing does is it looks at a parent or a set of parents, and it looks for specific, um, looks at more books, that's for sure, but it only looks to see, do you happen to have books that you might pass on to your kid? Nurture looks at every page, every word in every book in the entire library. And then it looks for certain words in those books to make sure they're spelled correctly. Because if they're not spelled correctly, you might have a disease, a condition that puts you at risk for a health outcome. So prenatal screening, very important. And a lot of people do prenatal screening. And prenatal screening looks at big stuff. And the big stuff you may not actually be able to do anything about, right? So prenatal screening often screens for things that are deadly or things that there are no treatments for, things that may have really terrible health outcomes. So for the purpose of people understanding that so they can make decisions about pregnancy. Nurture, though, is testing healthy children. So babies who are born, children under 3, they appear to be nothing wrong with them at all, just walking around or cooling in your arms, looking like normal people, but they have a hidden health risk. Something that your prenatal testing, your 23andMe, didn't show you any evidence of. Because some of these things you might not even carry and just show up in your child. But having that information, knowing that the words are written wrong in the book, like there's typos, helps you as a parent find that hidden health risk and take the next steps to have, better outcomes or at least alleviate some of that medical burden for your child.
All this is so interesting to me. I mean, because I think sometimes the world of genetics feels like scary for those of us who don't live and breathe it every day, because it's new. That's just why, because it's new, and it feels new to me, and that we don't have like a frame of reference, right? So we kind of, when we're in our parenting journey, we're using our frame of reference constantly. We're either repeating what we experienced as a child, or maybe we're trying to undo what we experienced as a child. We're kind of like we're doing one or the other, like constantly.
So
right?
true.
Yes.
So true.
So what I
Either
think,
gentle parenting or traditional parenting,
right?
Whatever the things are. You're
Yes,
right.
and
You're
the
absolutely
reason
right,
you
Emily.
choose it is because of something you experienced as a child. It's just the way it goes. So what I find exciting is like all of these kind of developments that are happening in this field and in other parts of science and medicine as well. Like I have kiddos who have chronic health conditions. I have one kiddo who has really severe food allergies. Like, I mean, they're real severe. And then another kiddo who has like a chronic asthma situation. And even though this is not linked or connected, but just the rate at which some of these developments are happening, the point I'm trying to get to is that I have who suffer from these chronic illnesses will have in their adult life ability to have more quality of life because of the developments that are happening. I think the same is true when I have daughters and I think about like their kids, like what feels new to us and trying to understand how our genes determine our diseases and our illnesses and what happens to us. They are going to have even more options and more knowledge and information. And I think it's so exciting that for parents who have young kiddos now today, that these are options. Like, you can be a part of that. Not only gaining that kind of information, but also setting up that frame of reference for your kids as they continue in to the generations and generations after. So it's a really fun, exciting thing for me
It
to think
is.
of, that this is something that we can participate in now.
Well, we're just at the beginning of
Right. Yeah.
this process, and I'll give you an example of something that Nurture does explore and give information about that could be put into use right now. So there's not a single parent on earth who doesn't at some time in their life wonder about their child's immune system health, right? Kids get sick all the time. They're constantly, in my office at least, for colds and ear infections and sinus infections, all kinds of things, right? And parents are asking me, is my child sick too much? When do I have to worry about their immune system? All of these kinds of questions. And they're normal questions. It's natural to ask these questions. Well, a bunch of the panel that Nurture looks at in this newborn and under age 3 assessment is about immune function. And is your child's immune system genetically competent? Do you have what it takes? And if there is a deficiency present, you would know long before that first cold arose, before that first infection revealed itself. And you would be able to take steps so that it wouldn't take 3 years of sinusitis and pneumonia and, God forbid, hospitalization. Or on the flip side, your kid is having those typical frequent infections, you could rest easy knowing that, what, they're just a kid. They're just a kid, immune system, not the problem here. And having that knowledge, that empowerment as a parent from the get-go is so helpful.
So I noticed as well that is really helpful. It's not that you are just screening in a panel for like 10, 12 things.
Right.
The paper that I saw was something like 4 pages long, like single spaced. I mean, I don't know if you know. Yeah, I don't know if you know the exact number offhand, but it's a large panel. This one swab is taken care of, correct?
Right. So parents swab their child. So let's say you have a newborn baby, right?
Yes. How does it work? Tell us how it works.
So you have a newborn baby, or you have a child up to age 3, and you order the kit online, and we send you the kit, and you take a swab of your child's cheek. It's not even, you don't have to collect, a big tube of saliva or anything. It's just a cheek swab, and you send it back. And our partner at the Broad Institute does the testing. They analyze the genes, the genome, and screens your child's genes, all of their genes, for 413 conditions. It's a lot of things that we're screening for. It's childhood cancers, it's heart conditions, it's immune system things, it's kidney diseases, it's eye issues, it's the whole body things. It's not every single condition your child could ever have. It's not that, but there are all conditions, neurologic things too. They're all conditions that have treatments or actions available to take that present in childhood. So as a parent, you would want to know about them because they'll appear in childhood and they have something you can do about them. And by knowing about them in this early time, you can partner with your pediatrician and with specialists in your area to take those next steps. So Nurture helps you in that way too. If you give us consent, we send the results to your pediatrician. You meet with the genetic counseling team, our genetic counseling team, and your pediatrician can too, to really get that in-depth understanding of what's going on. Our care navigators will help you make appointments with specialists who would be the right fit for the condition that your child is at risk for. and we support you. Nurture is not just a name, it's an action. And we nurture the pediatrician who is, on your team, and we nurture the families too.
That's really awesome. I love the collaborative effort for sure. And I just want to, you know, maybe ask a few boring questions. These are kind of
Oh,
like
please.
practical questions that are popping
Right.
through my head. Boring, we love. Just to be clear, do you have to have like a referral from your pediatrician to do this? Do you have to have already some kind of diagnosis? Like, how does all of that connection work?
That's a really important question. So, you do not need your pediatrician to write an order for it. You can go directly online and look through all the information, make sure that you're, understanding what's going on, and order the kit yourself. We've got we definitely are a physician-led organization, so we've got physicians involved, and as a result, we take care of the ordering on our side. But we do partner with your healthcare provider. So whether it's a family medicine person or a pediatrician, we partner with them if you give us their information, so that results will go to them as well. So you don't need their order, but we want to participate in a collaborative way with your provider. You also asked about, do you need a diagnosis? Actually, just the opposite is true. If you've already got a child with something going on, let's say their development's way off, or they've had a seizure of some type, or there's something else happening, nurture may not be the right test for your child. Actually, our test is designed for children with no symptoms. Our screening is designed to detect hidden issues, and children who are already experiencing issues really should talk to their own healthcare provider and get a much more specific assessment done by a specialist or their pediatrician or a healthcare provider, to get a very targeted test.
Yeah, that makes complete and total sense. What about, and I know this is just from the vibe I get when talking to other people about this, one of the areas of major concern, and that's privacy and the security of the information, what's done with that genetic information. So I know that's kind of a not as fun topic, but can you give a little bit of info on that?
We are really happy to talk about storage, security, privacy, all of that. And so let me start by saying that your child's genomic data is stored by our partner at the Broad Institute. And the Broad has a 30-year track record of handling sensitive patient information. They've done over 500,000 genome samples and doing them every day. They are used to hosting this data. They have the highest security capability possible. So that really, the security side, locked up with the Broad. Now, about privacy and sharing, as the parent or legal guardian, you are in control of your child's information. Nurture will not share your information without your consent. We will provide your pediatrician with results if you give us consent. We want to do that, but you will be the one who, you are the one who is giving consent. It is your data, your information.
Awesome. The other question is like, what is the cost of this? How does it interact with insurance? Is it FSA, HSA? There's
Yeah.
so many PP, whatever. Like, how does all that work?
Yeah, the alphabet soup of
Yes,
insurance. Yes,
it's
I'm
A, B,
very
C,
familiar
D, E,
with
F
it.
insurance. What do we do? I don't know.
Emily, I would love insurance to cover this, wouldn't you? I mean, and don't you think they should? I mean, they should, right?
And
So,
co-pays and
yeah, right.
prescriptions and
Yeah,
don't get me started.
co-insurance and deductibles.
Yes,
Let's
it's
talk all
the
the
beginning
language.
of the year and all of our deductibles gone.
Nobody goes to the doctor for
I
the first 3
know.
months, right? Well, actually, even at the beginning with prenatal testing or cancer genetic testing, insurance didn't cover that either. Back in the day, right? I had breast cancer 12 years ago, and I had to pay for my own genetic testing for my cancer because insurance just didn't cover it back then. Well, it covers it now. I mean, that's the story, right? That's the story of insurance. You've got to sort of prove its value. You've got to show that people really think it's valuable and necessary before insurance will do it. So we're not there yet with this. That's just the honest to God truth about it. I wish we were, and we'll get there, but we're not there now. So the list price for this is $1,800 to do, and that panel includes all 413 conditions. It includes having the genome assessed, the screening of the test, all of the genetic counseling we talked about, access to the care navigators, all of that is included in that. But for people who are watching this Facebook Live now for a limited time, we are offering a discount for Dallas moms. Yes, indeed. So for $900, if you go on the website, you can access this service for half price. So we really want families to experience this, to get an opportunity to have their children screened for these conditions. And so have at it. Go to nurturegenomics.com, and the discount's already applied in there for a limited time, and you can just experience this opportunity as a Dallas mom.
Well, that is really good to know. Is it eligible for like medical savings accounts?
FSA, right?
I think you can, right? That should
you can.
Just like orthodontics aren't often covered, and we have to use the HSA or FSA for that.
Thanks, Emily, for bringing that up again. I forgot to mention that.
You can use that, right?
Absolutely right.
Okay,
you can use your FSA and HSA for this. Yes, for sure. And you can do more than one child. So, I mean, if you've got a newborn and a 2-year-old and you want to do both kids, you can definitely do both kids. If you have a child you've adopted and you've got a natural born child, you can do both kids. I mean, there's all comers.
Yes, fantastic. Okay, so we do have the website up here. We also have a clickable link to go to the website in the description box. Once we're done in the comments, I will go on and put the information about the discount, which is fantastic. So
who doesn't love a bargain? Who doesn't love
bargains? Yes, I can get sucked into a deal like nobody's business. So if you want to learn more about this, honestly, the best way is to just click the website, go to the website. The information's there. As she stated, the discount is already preloaded. I don't think you have to have a code or anything, which that makes it so much easier. And if you have questions, I've been checking kind of comments a little bit as we have gone on. I haven't seen anything pop up, but if you do have questions, you can leave them now, and we can even answer them, after we're finished. You can go back in and kind of see if there are anything that I didn't ask, because I'm sure there is something that I didn't think to ask.
And if any of your viewers or members of the Dallas Moms Group want us to talk to their pediatricians about this as well, we would be more than happy to talk to their physicians, their OBs, their pediatricians, help them understand more about this as well. So they can either connect directly with me. I'm just Molly at nurturegenomics.com, not even a doctor in front of it, just, being casual.
So relatable.
Woo! So just Molly at nurturegenomics.com. And we would love to talk with their pediatricians or their OBs as well, and help them understand how we partner with them. We sort of lessen the load. We do a lot of the heavy lifting on their side, so that we can encourage more and more people to get this screening done and find those hidden health risks, and really do that great and relieve any kind of worry that parents might have as well.
Well, I appreciate you taking time for me to pelt you with all my questions. I do find all this really fascinating and exciting too, that particularly for like younger parents, that they have these options available, and just excited to see how this is going to grow. So thank you for sharing that with us, and friends, we'll see you next time. Bye-bye.
Thanks, everybody.